I felt like my life was being crushed. It was by far the worst illness that I personally have ever experienced.
It wasn't just the worst illness 35-year-old Chris Sudduth faced, but also one of the worst times in his life.
You know, the thing about it, Maureen, I couldn't have my wife holding my hand at the bedside. I couldn't have my children there to hold their hands. I was all alone.
Alone, kept away from his family as he battled the coronavirus.
Did you have to kind of face your mortality when you're sitting there by yourself and feeling terrible?
You know, I have faith in Jesus Christ, my personal Savior. And I just felt like I was not going to die, that I was going to overcome this.
He says his faith was there to save him when his job as a doctor put him at risk.
I was exposed, significant exposure. And there were many others who were also exposed. And that is where I contracted coronavirus.
On March 21st, Sudduth says he showed up to work at Jane Phillips Medical Center. He was a hospitalist there and had about 2 weeks left on the job before leaving to start his own practice. A patient there was coughing, had a fever, and on oxygen, all the telltale signs of the coronavirus.
So I noticed that he had yet to be tested. I ordered for him to be tested, and then I ordered for him to be put in isolation just in case he had coronavirus.
And just as he was about to put on a N95 mask to see the patient,
staff was present and reminded me that the hospital policy at the time was that masks could only be worn, the N95 masks, for patients that were already diagnosed with coronavirus.
Sudduth says he was the first one to suspect the patient had COVID-19. And since it was still early on, hospital policy meant he could only wear a surgical mask, which doesn't protect the wearer from the virus.
Patients who had yet to be diagnosed, we call them PUIs, or persons under investigation. We weren't allowed to wear N95 masks in those cases.
The policy was later changed to require N95 masks when seeing potential COVID-19 patients. But
unfortunately for me, that was 2 days too late.
Hi, you reached Caitlin Pond. Sorry, I can't get the phone right now.
Representatives at Ascension St. John's didn't return our calls, but did text back saying they had deadlines involving care for patients and that they will get back when appropriate.
I know that it was a bonehead policy. I think just about anybody would say that, especially in retrospect. I certainly don't hold any bad feelings towards anybody, though.
The feeling that's left is one of gratitude for beating the virus and being able to hold his wife and kids once more.
I think those might have been the longest hugs I've ever given somebody. And this is such sweet reunion, sweet time.
Reporting in Tulsa, Maureen Wirtz, Tulsa's Channel 8.